Hey you, have you heard of appendicitis before? Alright, I'm sure you've heard of it or you've come across it at some point before now. So let's discuss. It's the Bad Doctor and I want to take you through something wonderful. Now, as I said, appendicitis concerns the appendix. Now, the appendix is a tube-like organ which is located in the lower right abdominal region. It is part of the large intestine, and its use or its function hasn't been really explored yet, and so we don't really know much about it, just that it is part of the digestive tract or part of the large intestine. Now, appendicitis is inflammation of the appendix. Something funny about the appendix is that you really can live so much, a full life, a very wonderful life, a very beneficial and healthy life without your appendix. In fact, in some places or by choice, once a child is born, they can decide to take away or remove his appendix or her appendix so that it will cause no problem for this child in the future. So some places they do that. So if you are thinking your appendix is a very important organ, well, not so much. You can really live without it. Now, appendicitis is inflammation of the appendix. Now, what is inflammation? Inflammation is something that happens when probably a part of your body is infected. So appendicitis is caused by clogging or infection of the appendix, which then causes it to be inflamed. Now, this is what happens in appendicitis. Now, in appendicitis, because there is an infection, you have to run temperature. Yes, you'll be febrile and your temperature will be high because there's an infection. It's the normal response. You will feel a lot of pain. Yes, you will, which will begin probably from the lower right abdominal region or the navel and radiates around the lower parts of your abdomen, or can go a little higher. You might feel nausea, you feel irritated, you might vomit. Yes, it's part of the things that will happen. And if it's so severe, you might have a diarrhea. Yes, you might have diarrhea because this is the way your body is telling you that part of your digestive system is infected and something needs to be done about it. Now, how do you know it is appendicitis? That is another question. Now, because of the nature of appendicitis and because there are no classical signs, what I mean is there are no definite signs that will tell you, yes, this is appendicitis. So appendicitis by a layman can be confused for something else. If a woman has appendicitis, she might start thinking it's something related to her period, or it's something else, or something that she might not even know. But your doctor would know it's appendicitis because there'll be tenderness along your McBrunner's area. Now, your doctor will know where that point is. Or if you are medically inclined, or if you really know what that is, then you might feel some tenderness around that area, which is the location of your appendix. Now, if you want to know more about the McBrunner's area and stuff about that, I can just drop a message for me in the comment section and I'll be glad to tell you about it. Now, when you begin to feel all these things, it is important that you see your doctor, because you don't know what exactly it is. That's why I said you should visit your doctor. Your doctor will be the one to tell you whether it's actually appendicitis or it is something else. He'll observe you, examine you, and then know what to do. But when you see all the signs I've talked about, nausea, vomiting, the very important one, the pain around the location of the appendix, that is very important. When you feel that pain coupled with this stuff that I talked about now, please see your doctor. Simple antibiotics will not solve it. Yes, it might tone down the pain a little because it's an infection. Antibiotics, yes, will do a lot for the infection, but see your doctor, because after that point, the infection would subside, but then it will surface again because your appendix is inflamed. You are still eating, you are still doing a lot of things that will be troubling and triggering the pains of the appendicitis. So please visit your doctor. Now, the major treatment for appendicitis is surgical removal of the appendix. Now, don't get scared. I told you the appendix, you can live fully and an extensive life without your appendix. And so when your doctor tells you you need to undergo an appendectomy, that is removal of the appendix, don't get scared. He probably knows what he's talking about, and he probably knows how to do it right. So please, so that it doesn't get so severe that removal of the appendix will be troublesome Visit your doctor once you see these signs. Eat healthy, eat right, and try not to eat things that will disturb your appendix or your digestive tract as a whole. All right, have a nice time and take care of yourself better.